I do think everybody wants the truth, however uncomfortable it may be for either or both parties. All anybody wants is simple human honesty and communication. The insanity and the loss of dignity and common sense is insane. It's outrageously expensive. We could have gold-plated hospitals if we cut this adversarial system with no alternatives. I have to fight the system whether I want to fight or not. And until the fight is resolved, nothing can improve for anybody. And whatever the outcome of the fight is, you've then got to try and pick up the pieces regardless of the outcome and try and somehow be normal again. It's time I shut up.
Very good. I have full sympathy. I agree entirely with everything you said.
It's crazy.
People rarely remember the actual words that were said to them. They always remember how they felt when those words were said.
Patient safety really is preventing harm. And a lot of people think that preventing harm is really focusing on medical errors, and so keeping doctors or nurses from making mistakes or keeping patients from falling between the cracks. But really what we're hearing at this conference is it's a lot bigger than that.
We recognise that patients are harmed in the healthcare system. We want change to that. We want to work together. We recognise that harm happens not only to patients and families, but when something terrible happens, it affects the doctor or the nurse in a very hard way as well.
We need the health system to be safe, and in doing that we need a lot of changes.
There's some basic issues that we need to address, and that's around infection control. It's around making sure that we've got the correct patient and the correct procedure, making sure that the patient has the knowledge and the information to actually consent to what's been happening to them.
In your Aboriginal culture, for example, there's an issue with interpretation. Is interpretation done well? And we're seeing that today put forward as a patient safety issue.
I think there should be a little bit more awareness of people's language barrier. That's one of the issues, because a lot of Aboriginal people don't speak English. That could be their second language.
One of the biggest issues, barriers and things that we're dealing with is institutionalised racism. It needs to be said and it needs to be dealt with.
When you walk into a hospital sometimes with some of the patients, you get the stereotype where they think, oh, it's an Aboriginal person, you know, why are they coming here, they're not sick, but they have got issues. There are issues sometimes.
We're also working together during this workshop to action plan for the changes that we'd like to see.
We'd like to create a consumer-driven and owned health alliance between healthcare providers, educators, consumers and carers.
It needs to be a consumer-driven thing.
The idea is to bring consumers and health providers to the table.
One of the strategic plans for the Office of Safety and Quality is about building a database.
Set up a patient for patient safety or Australian chapter website, getting people's stories on there in the form of podcasts so that people can actually go there and think, this is just ordinary, everyday people, this is their story, my story is the same.
The patient's pain and the family's pain is almost always greater, but if we could somehow shoulder some things visibly together.
We don't exclude any group, no matter how they're working out there. If they're working for consumers, is to bring it all together as much as we can.
One of the things that I'm really looking forward to is the declaration, the Perth Declaration, which we hope will culminate the event.
I want the Perth Declaration to be an inclusive document which gives us an aspirational idea, which gives us a sense of purpose about where we want to go.
Something that we can then spread throughout Australia and perhaps get other states to take on a similar sort of event in the near future.
I hope the Perth Declaration will
include a call for greater partnership,
which allows everybody who wants to participate to be involved, and which is absolutely crystal clear about the things that are most important to us as healthcare consumers. And that is, we're all citizens, we're all consumers, we're all potential patients, and we need to make the healthcare system that looks after us as safe, as reliable and as good as it can be.
You've got the London Declaration, you've got the one they did up in Jakarta. You know, they've done them in various other parts of the world, but nothing that's been tailored for Australian conditions. So I think having something that is specifically for Australia, something that's meaningful to Australians because it's here in our country, I think will have a huge impetus for people in other states.